Welcome everyone to today's webinar, Best Practices for Tobacco Retail Licensing Enforcement. I'm Julie Amajuoyi, a lead senior staff attorney at the Public Health Law Center. I lead our national legal technical assistance work, and I'll be moderating today's session. Before I introduce our featured speaker, my colleague Rachel Callanan, I'd like to say a few words about the Public Health Law Center for those of you who may be new to us. The center is based in St. Paul, Minnesota, at the Mitchell Hamlin School of Law. And I want to acknowledge that we are in the indigenous homelands of the Dakota people, also known as the Sioux Nation, and that 4 federally recognized Dakota tribal nations remain in the area. The region is shared territory with the Anishinaabe, also known as the Ojibwe or Chippewa. The Ho-Chunk Nation also has a historic relationship in this region. We appreciate the ongoing stewardship, the spiritual connections, and life ways developed in these homelands upon which our law school sits. The land acknowledgement here on this slide was developed by the Native American Law and Sovereignty Institute at the Mitchell Hamlin School of Law and is being used here with permission. For more information on the indigenous peoples in these tribal lands, we encourage you to visit the URL on the slide. So relatedly, we also want to acknowledge the difference between traditional and commercial tobacco. Throughout this presentation, we'll refer to the impacts of tobacco, but we want to clarify that we are talking specifically about industrial scale commercial tobacco production and not talking about traditional tobacco as it is used still religiously, medicinally, and ceremonially in many different cultures. There are 2 resources linked on this page for more information. So here at PHLC, we have a strong commitment to equity and health equity for all people. It's a core component of our work, and it's integral to all that we do. So the Public Health Law Center, as you may know, provides free legal technical assistance to communities, public health advocates, and other partners. And what we mean by legal technical assistance includes evidence-based research. We can help communities develop sample policy language. We can provide guidance on implementation and enforcement issues, which is the topic of today's webinar. We can also offer litigation support in defending policies that come under attack. We also develop many publications that are posted on our website, and we provide trainings and webinars on important issues like this one. However, we do not provide direct legal representation, and we do not lobby. So again, our topic in today's webinar is best practices for tobacco retail licensing enforcement. Rachel Callanan will discuss the best practices for achieving compliance with tobacco retail licensing policy, starting from the planning stages to implementing and sustaining the policy after it's been enacted. Rachel has been at the Public Health Law Center for over 6 years, and she currently leads the center's Minnesota Legal Technical Assistance work, which provides legal technical assistance on commercial tobacco issues to public health professionals and organizations, legal professionals, and advocates in Minnesota. With that, I'll turn this over now to Rachel.
Great, thank you, Julie. Today, I'm going to cover some of the enforcement best practices that Public Health Law Center has identified in the 2 decades of providing support to states and local communities for commercial tobacco retail licensing. We've categorized the best practices into 3 stages. First is the plan and prepare stage. So this is the pre-enactment or pre-amendment of the ordinance. So this is the stage where you're contemplating a new ordinance or changes to an existing ordinance. Next is a look at the actual provisions. These are specific enforcement-related provisions that would be included in the ordinance. And finally, we'll look at the practices to sustain your enforcement with post-enactment education and support for retailers, and the steps for effective compliance and inspections. It's important to consider these best practices as a whole and not just a piecemeal approach. So before exploring these best practices, I want to highlight what we will not be covering today. There are parallel enforcement and compliance activities. These are related to the FDA's enforcement of federal tobacco regulations. And there are also inspections for minimum legal sales age compliance for the federal SAMHSA SINAR program. I've included links here for further information about those enforcement activities, and you'll have access to these slides after the webinar, so you can click on those links. So a couple caveats on today's discussion. These best practices are based on general learnings and experiences from different states. You should always check your local and state laws before adopting such policies and practices. And nothing in this webinar is legal advice. You should consult with your own legal counsel. So let's start with the pre-enactment of an ordinance or before an ordinance is amended. This is the planning and preparing stage of the process. So first things first, important steps for effective enforcement start well before you enact your ordinance. The key steps here include identifying the retailers in the jurisdiction. This can be done by working with your cities or county to see what businesses may be licensed to sell tobacco. Once you have identified the retailers, you could conduct outreach and education about the laws governing tobacco retail licensing. This can be an important relationship building step with those retailers. Then next, before making any changes or adopting a new ordinance, local jurisdictions must follow any procedural requirements such as notice and public hearings. So be sure to review what procedural requirements apply in your jurisdiction. So back to the education and outreach point, one good resource for retailer education I mentioned is the FDA's This Is Our Watch. The focus of this educational program is to help bring tobacco retailers into better understanding of FDA tobacco regulations and the importance of ensuring that underage persons are not sold these products. So your state may also have state-specific retailer and employee training options. So I urge you to check with your local commercial tobacco programs to see if you have more applicable state level or local programs. So next in your plan and prepare stage is to identify who will be in charge of enforcement. So who will actually be out there conducting the compliance checks and inspections. Typically, it is local public health or a licensing department, and often law enforcement is part of the process. Sometimes the local unit of government will hire an outside contractor to conduct the checks. And I want to just another caveat, there's an important caution that for equity reasons, many communities are moving away from engagement of law enforcement for these checks and inspections, and instead really treating them more as code enforcement and more business licensing focus. So next, you want to be planning for enforcement of all aspects of your ordinance. We often see that compliance checks are mainly focused on underage sales. But if you have other requirements or restrictions in your law, you need to be planning for how you will follow up with enforcement. So for example, if you have a flavor restriction or a minimum price provision, how will you check for compliance? And then one final point on this slide is about license fees. A practical approach to enforcement ensures that local jurisdictions set appropriate fees to cover all costs of administering a license. Enforcement takes time and it costs money. Fees provide revenue for the administration and enforcement of the ordinance. They can also cover costs of retailer and community education. So periodic review and adjustment of licensing fees will ensure that they are sufficient to cover all administration, implementation, and enforcement costs. But how do you know what appropriate fees are? Public Health Law Center has developed some tools to assist local jurisdictions calculate the true costs of tobacco retail licensing. So our online tobacco retail licensing calculator and our publication on retail license fees provide more information about retail license fees and license fee checklist. Included are costs of processing licensing applications and renewals, retailer education, the costs associated with actually conducting compliance checks and inspections, such as training, planning the inspections, and costs for time doing the inspections. These are a couple screenshots of the actual calculator on our website, which is also available as a downloadable Excel document, so you can easily work through the different factors that will add up to the total costs of implementing and enforcing your tobacco retail licensing ordinance. So next we shift into the stage where we're looking at the enforcement related provisions. These are the provisions that would actually be included in the jurisdiction's ordinance. So Public Health Law Center provides free legal technical assistance on commercial tobacco retail licensing. Every state and locality will be different. So we don't have a national tobacco retail licensing model ordinance. However, we do have local model tobacco retail licensing ordinances for Minnesota, California, and New York. So you could consult any of these to get some sample language provisions, but also please reach out to Public Health Law Center and we can help you craft the best language for your jurisdiction. So now we're at the stage of drafting or amending the ordinance. Here are some of the key policies to include in the actual ordinance that will set the jurisdiction up for successful implementation. On this slide, there's a few I've already touched on in the prepare and plan section. So here's where all that prep work will be now put into motion in the actual ordinance. So first is setting the license fee. So we talked about calculating the true cost of licensing. Here's where you'll insert that amount that you've calculated and require this as your annual licensing fee. Next, requiring instruction for licensees and their employees. Like I noted, some states have their own programs for training. So identify, or if you need to, you may need to develop a training that's specific for your jurisdiction. Include a provision specifying the department responsible for inspections. And that's important, so it's clear in the law who has that responsibility. Here are some other key policies to include in the actual ordinance. These are reflected in the Public Health Law Center models for Minnesota, California, and New York. So like I noted, you could review some of these policies to get more detail on language. I'm going to give you the high-level overview. And again, urge you to contact Public Health Law Center for assistance if you're contemplating, moving in this direction. So first, quick overview of these, and then I'm going to go into more depth in the following slides on these individual ideas. So first, limit the number of licenses. Next, require signage and offer free signs for age and other restrictions. Require comprehensive compliance checks and inspections for all provisions in the ordinance, and require penalties that focus on the acts of the retailer. So I'll go into more detail on some of these ideas. So first, looking at limiting the number of licenses in a jurisdiction, this limitation or cap on licenses can act as an enforcement mechanism. While these provisions are primarily intended to reduce retailer density, which is important for both reducing youth exposure and reducing exposure for people who have quit or are trying to quit using commercial tobacco. But there's an added benefit of making inspections easier. There are fewer number of licensees to inspect. Jurisdictions will be better able to monitor compliance with all aspects of the ordinance with fewer inspections that they have to conduct. So there are several ways to limit the number. Communities can limit the number of licenses issued for retailers by setting a maximum number or capping the number of licenses. Most jurisdictions that do this do it through attrition so that they're not actually, pulling licenses away from existing businesses. Other options include proximity restrictions. These could limit how close retailers are from other retailers. They could set a minimum distance between youth-oriented facilities and retailers, or they could prohibit or limit retailers in residential zones. So I've linked a helpful resource here that helps explain these options in more depth. So next, requiring store signage that communicates the requirements of the ordinance. So jurisdictions could design and provide free store signage for retailers. Examples here are for minimum legal sales age and ID checks. There's an example of an age calculator and sign, and another from Minnesota communicating that coupons and price discounts are not accepted. So this kind of prominent signage in the store takes some of the pressure off of clerks. Sometimes customers push back or they're complaining about the policies or practices. And so a clerk can turn to these signs and say, sorry, it's the law. Next, the ordinance should have a provision that requires comprehensive compliance checks and inspections. You're picking up on a theme here, I'm sure. So the provision would address both underage sales as well as verifying compliance with all provisions in the ordinance. A best practice would be to require at least 2 or more annual inspections and even require a follow-up check or inspection after any violations to ensure that and verify compliance moving forward. So provisions in the ordinance should always focus on retailer compliance. One provision that Public Health Law Center includes in our model ordinances is a provision that clarifies that the acts of employees are considered acts of the licensee. This example, taken from the Minnesota Model Ordinance, holds the retailer accountable for any violations of the Tobacco Retail Licensing Ordinance. The buck stops with the retailer. So this provision also points to the importance of employee training. Since the retailer will be held accountable for acts of their employees, they have a strong interest in training employees to get it right. So related to the focus on retailer accountability, the Public Health Law Center model focuses penalties on the retailer. So retailer penalties may include civil fines, license suspension, or license revocation. If there are any clerk penalties, which we don't typically recommend, but if you do include them, they should really be focused on retraining the employee and not a monetary fine on these typically low-wage employees. Finally, since tobacco retail licensing laws are focused on retailer behavior and accountability, purchase, use, possession, or PUP penalties have no place here. So in keeping with this focus on the acts of the retailer, Public Health Law Center's model policies do not include penalties for underage purchase, use, or possession of commercial tobacco products. The purpose of a tobacco retail licensing ordinance is to regulate the retail sale of commercial tobacco products. As we've discussed, a cornerstone to effective regulation is to hold the retailer accountable. Penalties for underage purchase, use, possession do not have a place in a tobacco retail licensing ordinance. It is a best practice to focus enforcement on the actions of the retailers, not on the purchaser. So moving on to the next stage of enforcement best practices. And this is the post-enactment or ongoing support for retailers to really help sustain these laws and to ensure that effective enforcement practices are followed. So let's start with retailer education regarding the ordinance. We know most retailers want to comply with the law, but sometimes there's confusion about what the law requires. There are some key strategies you can take to explain the law and support retailer compliance. First, be proactive with education. Send a mailing to tobacco retailers outlining the existing or any new provisions in the law. The image here is a handout created by our partners in Minnesota in Benton County with the assistance of Association for Non-Smokers Minnesota. They used images and simple language to explain what may or may not be sold following their new law to prohibit sale of flavored products. So use simple graphics to explain the requirements and even check reading level to make sure that it's accessible to a wide range of people. The letter or mailing that you send out could also include the actual ordinance language or information on where they could find the ordinance online if they want to actually read the language of the ordinance. And then the letter should specify the effective date. So there's no confusion about when these provisions will be subject to enforcement. So this is the rest of that fact sheet from Benton County that was distributed to retailers. I just think it's such a great example of a simple, clear communication about the requirements of the ordinance. So continuing with our theme of retailer education, here are some other things communities can do to make sure retailers have the resources they need to comply with the law. One thing a lot of jurisdictions do is they create a landing page on their jurisdiction's website with the resources. So this would include links to the law, the fact sheets, signage that's available, and importantly, contact information in case they have any follow-up questions. So this makes the information easily available, easily accessible anytime, even when someone may not be in your office to answer questions. Posting these resources can save a lot of staff time in answering simple questions that retailers may have. Another idea is to host a webinar to explain the law, explain the requirements, and to share the resources. A recording could be posted online, so retailers will have access to the information in this format in the future. So I wanted to share this example of an online toolkit that New York City hosts on their website. It has a letter from the health commissioner, overview of the New York laws, information on penalties, posters, signage, and opportunities for training. And the extra bonus here for New York was all of these resources are offered in multiple languages. So an important part of this stage of the license is the license application and renewal process. So ideally, the jurisdiction has done some planning for this process and has adopted robust licensing and renewal practices that reinforce these best practices. So some examples of best practices for licensing application and renewal. Require a complete application for all new and renewing applicants. So don't allow like a more simple truncated process for those that are renewing. Also, don't allow any transfers of licenses. Make sure that any new licensee, even if it's a transfer, they're expected to come in and apply with a full application process. Education materials could be incorporated as part of an application process. So, you can do a mailing and let, the existing retailers know when they renew, here's information that they will need to acknowledge or take care of. So in that packet, you can include a checklist of the key ordinance provisions that are subject to the application and licensing. Require proof that training was completed. So you could require a list of current employees with certificates of completion that they did complete a training program. I have an example here from Minnesota of one of those certificates of training. And then finally, the application should include an attestation or promise to comply with all aspects of the ordinance. And this is just an acknowledgement by that applicant that, yes, I have read, I understand all the requirements of being a licensee, and I agree to abide by those requirements. So moving on to compliance checks and inspections. Often the biggest focus we see for an enforcement is focused on minimum legal sales age. And while these are incredibly important inspections and compliance checks to do, we sometimes see people leave the inspections for all the other provisions in your ordinance as a secondary or sort of an afterthought. And so that's why I'm really emphasizing today this comprehensive inspections that you want to do. But back to the minimum legal sales age checks, you'll want to tailor your compliance checks for the community. So what are the demographics of the community? What are the products most frequently purchased by youth in that community? What's the right time of day to purchase? Follow a proven protocol for training the underage buyers used in a compliance check. And then make sure your checks are unannounced and that they are staggered in time. So retailers can't tip off other retailers that, hey, today is the day underage compliance checks are being done in our community. It happens. So think about that. And then moving on to inspections for other aspects of the tobacco retail licensing ordinance. It really starts with making sure that inspectors are properly trained to be looking for compliance with all provisions in the law. An inspections checklist is frequently used and is a great tool to facilitate inspections. Again, checks should be unannounced and should be staggered to ensure retailers aren't tipped off that inspectors are coming through on a particular day. So finally, if there are any violations, the jurisdiction should follow through with giving licensees appropriate hearings and follow an appeals process for any appeals that may arise from violations. So, and jurisdictions can continue and should continue to support and educate retailers about the law on an ongoing basis. Again, an annual renewal notice is a really good opportunity to share resources and remind retailers about all aspects of the law. So that is my portion of the presentation. I think we do have a few minutes for questions, so I will turn it over to Julie, who has been monitoring the chat.
Thank you, Rachel, for that very informative presentation. One of the questions we have in the chat is, are tobacco retailer assessments or audits the same things as compliance checks?
They're a little different because when you're doing an audit, it's usually just to go in and check to see what types of products are being sold. Sometimes they are looking at violations of the law, but typically the audit is an information gathering tool and not necessarily an enforcement tool. I think they probably could go hand in hand. But when you're doing your enforcement inspections, you really want to have a trained inspector who knows what they're looking for specifically, knows the law, and how it needs to be enforced in your jurisdiction.
Thank you, Rachel. Another question we have here is, who is responsible for making retailers comply?
That varies from community to community. And so, it's really up to, one of my earlier slides, I noted that, often it's a local public health department because they have more expertise in this area. Sometimes it's licensing enforcement or code enforcement employees. Sometimes we do see law enforcement engaged in doing these compliance checks. And then we do see communities that actually hire outside contractors that have expertise in this area and can come in and conduct the compliance checks on their behalf. So I think it's a variety. I would say an ideal would be to have like collaboration among, all of those potential folks working at the local level.
Thank you, Rachel. So before we wrap up, I'd like to bring your attention to some of the resources we have on our website on this topic, including our model tobacco retail licensing ordinances. And so with that, again, we're available. We provide free legal technical assistance and commercial tobacco control policy. And Rachel, go to the contact slide, please. The next slide. So here we have our contact information. Please don't hesitate to reach out to us for assistance. Thank you so much for joining our webinar today and have a good rest of your day.